Welcome to the UT Healthies Texas Virtual Education Series. Today's presentation topic is Risk Assessment and Prevention of Heart Disease, featuring Dr. Zafar, board-certified cardiologist at UT Healthies Texas Physicians in Athens.
Hello, everyone. We're here today to discuss the effective screening for heart disease, the different tests, what we need to look for, and discuss how we can prevent heart disease for our patients and for our patient population around us. So I'm Dr. Saima Zafar. I am a cardiologist practicing here in Athens, Texas, a lovely town that we enjoy being in. So starting off, identifying risk factors and heart disease. We look for risk factors based on the newer guidelines. The newer guidelines were from 2018, and it is the ASCVD, Cardiovascular Risk Estimator Plus, that we do, and you can actually look it up online, but it's called ASCVD Risk Estimator Plus. And it looks at different risk factors that we put together, and then through a calculator, which is actually online, and you can put that information in, you can see what your risk is. And based on that, you will know that you need to seek attention early on so that you can prevent heart disease. Some of the risk factors that we start looking at in that particular risk assessment include age. So men above the age of 45 and women above the age of 55 start getting higher risk for heart disease. Now, the risk does not start there. It can start at a much younger age if you have a very strong family history. Family history, we define as having a male relative, first blood relative, with heart disease at 55 or above, or a female first degree relative with a heart disease at the age of 65 or above. So if you have that, you have to be much more focused on your heart health much earlier. There are reports of children as young as 3 who have had familial high cholesterol because of their family and have had to start medication to control that. So it can start at a younger age if you have a strong family history. So looking at the age, please be more aware of your heart health over time as we get older, as mentioned before, men above 45 and women above 55. The second thing is gender. So men are at a higher risk of having heart disease. And so, of course, men need to be much more careful about managing their risk factors and keeping their heart health. Women have a risk of heart disease once they get to 65 or older, are usually 10 years after men are at risk. But women need to make sure that they focus on their heart health early on too, because they do take a lot of stress and neglect themselves taking care of all the responsibilities that they have to endure. The third thing is race. Southeast Asians, African Americans, Hispanic population have a higher risk of having heart disease. It comes from genes. It comes from what happens in their environment. So again, particularly people from the Southeast Asian subcontinent, they have a much higher risk of heart disease early on. So again, looking at the race, please make sure that you assess your risk, you look at your community, and you attack the risk of having heart disease early on and prevent that. Then we come to other risk factors. Other risk factors include diabetes. Diabetes is a very, very important risk factor. Unfortunately, we're seeing diabetes at an earlier age now because of the poor diet we have in our society, poor health habits, lack of exercise, more stress. And so all of these things add on and have been causing more or higher frequency of type 2 diabetes. So anybody who has a diabetic has a much higher risk of heart disease. So that, again, adds to our risk factor profile. The next thing is high blood pressure. High blood pressure is a silent killer. We have a lot of patients who come and tell me, well, I don't feel anything with my high blood pressure. Well, of course you don't. That's why it's called the silent killer. So if that's what you have, you need to make sure that you are very strict about your numbers. Interestingly, the most recent guidelines with the ASCVD cardiovascular risk assessment actually look for a top number, which is the systolic blood pressure of less than 110. It used to be 130 and now 120, and now it's gone to 110. So you can see that a strict control of your blood pressure is extremely important. And you need to keep an eye out for that. So basically they're saying that after the age of 18, you need to get your blood pressure checked at least every 2 years. So very early on, at a young age, keep an eye on your blood pressure, because a lot of people come in when they're in their 50s and we find out that they've had a blood pressure for a long time and now they're suffering from the complications of long-standing high blood pressure. The next risk factor would be smoking. Smoking Chewing or dipping tobacco, again, a very, very high risk factor. The sad part is that 1 out of every 3 people in Texas is a smoker or dips tobacco. And that significantly increases the risk of heart disease. It's one of those risk factors that, has caused tremendous amount of harm to our communities, to our lifestyle, to our health, hospitalizations, and all the other complications that are associated with smoking. So please encourage your family members, yourself, your friends, to work on quitting smoking or avoid smoking. This is particularly more important for our younger generation because they sometimes watch it in their community or their friends and they adopt this lethal habit. So we really need to be very careful and work on quitting smoking and not chewing tobacco. Next risk factor would be a previous history of stroke. So if there's a previous history of stroke in our patients, again, risk of heart disease is high. Kidney disease. So anybody who has what we call the GFR, the latest guidelines say that anybody who has a GFR less than 60 is at a high risk of having coronary artery disease or heart disease. So again, if you have kidney issues, please make sure you get screened for heart disease. You take all the precautions to prevent heart disease. Blood pressure. Like I mentioned earlier, the top number and the bottom number of the blood pressure are extremely important. So keep every 2 years, check it after the age of 18. And if it starts trending upwards, make sure you get it under control. Take all the precautions you can to keep it tightly controlled. We've seen patients who may not understand that there are certain things in their diet that can simply drive their blood pressure up. So please be cautious of that, and I will discuss that later on. Your cholesterol, that's the next risk factor. Cholesterol is extremely important. We look at your LDL cholesterol, which is the bad cholesterol. We also call it the lousy cholesterol. So the latest guidelines say that if your LDL or your bad cholesterol is above 190, you're already at a high risk of heart disease and need to be on a statin. So please make sure you get your cholesterol checked and know your numbers. The key thing about your health is knowing your numbers, knowing your weight, knowing your blood pressure, knowing your cholesterol. These are the key things that will empower you about your health. So look at your bad cholesterol, see what that is. Then the good cholesterol, which is the happy cholesterol or the HDL. The HDL should be greater than 50. And it used to be a target of greater than 40 for men and greater than 50 for women. But we are looking at more and more importance on the importance of keeping this higher so that this, in fact, helps your heart disease. So a happy, higher HDL is important and a low, lousy LDL is important as well. So these are some of the risk factors I've mentioned. Now, there are some interesting risk factors that have come up in the recent studies, and those include women who have had gestational diabetes. So if you have had diabetes when you were pregnant, in future, you are at high risk of having heart disease. In fact, a much higher risk of having heart disease. So any female who has been pregnant and has had diabetes during pregnancy, please watch out for your heart health immediately. Make sure you keep your weight under control, your diet under control, your cholesterol, your blood pressure, because the future can be dangerous for you for heart disease if you do not do that. Another one includes inflammatory disorders like rheumatoid arthritis. Patients with rheumatoid arthritis also are at higher risk of having heart disease. So that is another risk factor that has been added to our profile. Depression. People with depression have a high risk of heart disease. So please identify it early. If you know somebody who has depression, please make sure they get help and also make sure they get screened for heart disease because depression and heart disease seem to be very closely bonded with each other. So again, this is another added risk factor or something that we need to watch out for. Breast cancer treatment. So breast cancer treatment can increase risk of heart disease. And how? Radiation to the breast obviously leads to the area which is covered where the heart is. So if you have radiation in that area, that can affect the blood vessels of the heart. And in future, many years later, that can come up as heart disease or heart attack. So if you've had radiation to the chest, that is a risk factor for heart disease as well. Other things we look for are patients on a cholesterol medicine, which means they have a problem with high cholesterol, and so they are at risk. Are they on blood pressure treatment? So we also look for those medications. So this risk factor assessment thing looks at all these things that you may have a normal blood pressure when you're being checked, but you could be on blood pressure medicine, showing that your risk is higher. So these are some of the risk factors we look for. Now, what are the preventable risk factors? You can certainly not do anything about your age, and you cannot do anything about your family history or close relatives having heart disease, because that's part of your genetic makeup. But there are certain things you can do to reduce your risk of heart disease, or at least prevent it from coming on. One of those includes your physical habits, your exercise, your diet. So the recommendations from AHA, the new ones, are that you need to exercise 150 minutes a week, which would be moderate exercise. So divide it up. You can do more one day, less the next day, but at least as long as it accumulates to 150 minutes a week, that is ideal, and that will help lower your risk of heart disease. It will lower your LDL, improve your blood pressure, raise your HDL. So all these things get impacted by exercise. One of the other things is your diet. So please check your diet. It's like you do an audit of your diet. You do an audit of your accounts, you do an audit of what you do on a daily basis. Please do an audit of your account. I often tell patients, they'll say, well, I don't eat that much. Just write down 1 or 2 days what you eat every day, and you will realize that there is so much that you could have eliminated and not even have missed it. So make an account of what you eat every day. See what are things you could easily have not had and basically not miss them. So fried foods, greasy foods, these dietary things, fast food, they can certainly have an impact on your heart health. What is recommended these days is a Mediterranean diet. I often get asked, can I do the keto diet, or can I do the fasting diet? Or I don't believe any of these diets are what you can sustain over the rest of your life. What you need to do is have a healthy lifestyle with your diet for the rest of your life. So what can I do that I can stick to for the rest of my life and at the same time enjoy it and be healthy? If you look at the Mediterranean diet, they give you guidelines of what you can have. And so you basically adopt some of the things that you can pick in the Mediterranean diet. This diet has consistently shown to reduce the risk of heart disease and also reduce the risk of death. So I would say, please look at the menu or the choices that are provided by the Mediterranean diet and try to pick what will suit you and what will be best for you. So diet is critically important. A lot of people say, well, I travel, I work a lot. You can always plan your meals. Whenever you plan your meal, you'll make a smart choice. When you don't plan your meal and you'll say, I'll eat when I'm hungry, you will always have a disastrous diet. So please always plan your meal, because remember, you are what you eat. And if the most important thing, your diet is not planned, you will not make good choices for your health. So that's the critical thing. So coming from diet, then moving on to your sleep. So sleeping less than 6 hours a night actually shows that you have poor sleep hygiene. And poor sleep hygiene, again, increases your risk of heart disease, because it causes, plays a havoc with the adrenaline and the hormone system in your body. And so your brain doesn't rest and you have so many complications. It also triggers depression and other problems. So sleep hygiene for people who want to prevent heart disease is critically important. So please try to see if you can sleep more than 6 hours a night. Coming on to stress. Stress is a part of everyone's life. No matter what you do, you'll have stress. The issue is, how do we manage our stress? Do we have stress management ideas in our mind, or something that we can think of every time we go through a stressful situation? Is there meditation? Is it yoga? Is it walking outside? Is it breathing exercises? You have to have a collection or a armamentarium of stress release activities that you can do, which will help immediately diffuse or get rid of the stress that you're having. You suddenly hear information or some news about a relative or a child or somebody having a problem. Your child didn't do well in school, and you will get stressed and panic stricken. Think about breathing exercises. But you have to learn to manage your stress. It doesn't just go away on its own. Yes, you can rely on medication if it gets advanced, but simply managing it with stress relief exercises or different techniques is extremely helpful. Some people do Qigong. Some people do other types of meditations. Meditation these days is a key element of improving your stress and reducing your risk of heart disease. So please look at other things that can help you. Of course, prayer being the utmost importance. So always pray every day. And that will also help you release your stress. Coming back to your weight. Now, that is a big issue in our communities. With our diet, we tend to gain weight, and once it starts piling up and you're beyond like 25, 30 pounds, you'll say, well, it'll never come off. It's my hormones. It's my stress. There's always a reason to justify your increased weight. But there's also a reason to lower your weight. So try to keep a 5-pound range. And whenever you get to the top 5 pound that you don't want to be beyond, start thinking about techniques of cutting out on your diet and exercising more. 1 pound, burning 3,500 calories is 1 pound of weight. So try to find out, how can I burn 3,500 calories? You can see that on the treadmills, they have that gauge, which will tell you how many calories you're burning. So over a month, if you burn 3,500 calories without changing much in your diet, you could lose a pound of weight. If you drop 300 calories from your diet and burn 300 calories a day, that would be twice as much. You could lose 2 pounds a month. So try to keep a cap on where you want to limit your weight to and not go beyond, because once you do that, you will stay in a safe range and avoid the problems with obesity. So obesity, again, is a risk that we bring to ourselves. And on top of that, we bring high blood pressure, diabetes, depression, anxiety, all those risk factors attached to that. So please do check your weight and make it a mission to work on your weight. I've personally experienced counting my calories, looking at exercise, capping my weight. So these are things that I personally have done myself. And it's not one of those things that you say that it's easier said than done. It can be done, and it should be done. So please watch out for that. The BMI for the weight should be 25. So BMI is the ratio of your body surface area and your weight. You can check that at your doctor's office and say what my BMI is, and it should be 25. So try to see if you can stay as close to that as possible. Smoking. Please work on quitting smoking. Smoking is one of the worst things that we have seen people go through as far as coming to us and having the risk factors. It actually causes, very painful thoughts to me when I see a patient who's had bypass surgery or who has had other complications of heart disease or stroke who continues to smoke. Because you've been given one life by God, it's not going to be a repeat. And if you continue to burn it with smoking, you're not doing anything to help yourself. So please help your life and help your health and find different techniques, talk to your doctor, develop that motivation, use prayer, and see how you can increase your willpower and work on quitting smoking. So that would be a critical factor. If you do all the other things and not quit smoking, you're still causing a tremendous amount of harm to your health. So that is a critical factor that we state to our patients that you need to work on. There are medication out there that you can use that for. You can do meditation. You can do counseling. More importantly, get the support of your family and your friends. Maybe avoid meeting those friends who encourage you to smoke when you're together for a while, so at least you can get over it. And believe me, when you quit smoking, you will realize you don't even like the smell of smoking. So please stay away from that. The other thing is dipping. Dipping is very common in our society. Really, you need to work on stopping that because that's concentrated tobacco, and you have no idea how much harm it does when it goes in your blood vessels. It causes inflammation inside the blood vessels, not just your heart, but your brain, your kidneys. It can cause problems with, progression and future kidney failure, heart disease, strokes. So why take that chance to such important vital organs of your body? Now, blood pressure. When you have high blood pressure, it can happen because of multiple factors. You have a family history of high blood pressure, you will have high blood pressure. You can also have it because of increased weight, poor diet, stress. Other things that can cause high blood pressure are sleep apnea. Sleep apnea is one of the most underdiagnosed problems in our society. People have sleep apnea because they don't know it, so they don't even go looking for it. Usually they're told by their spouse or their significant other that you're snoring at night, and a lot of times they'll just get mad at that person. But honestly speaking, if you were ever told that you snore at night, you have high blood pressure, you're tired during the day, you're stressed, you're anxious, you're depressed, please be assessed for sleep apnea. It's a simple test. It can be done at home, and it can actually make a huge difference in your life. It can improve multiple risk factors because sleep apnea can cause anxiety, depression, fatigue, lack of energy, lack of motivation, high blood pressure, weight gain. So all these things can come together if you have sleep apnea. So anytime you have high blood pressure, please make sure you also look for sleep apnea, and that should be one of the screening things that is very, very important to be looked for. Monitoring your diet. If you start noticing that your blood pressure is trending upwards, please look for the amount of salt you eat. I'll have patients who have had blood pressure problems for a long, long time, and they're on 3 different medicines, but they're not controlling their salt intake. Oh, I had popcorn when I went to watch a movie and it was salted. Oh, I had chips when I went to watch the game. No, those things are out of your diet. Once you have high blood pressure, please be very conscious of the fact that extra salty food like chips and the nachos and the popcorn that is salted is not good for you. Other foods with preservatives in them, TV meals, they all have a high salt content. Sodas have a high salt content. So when you eat, know what you eat, read the labels. Look at the sodium content. If the sodium content is high, because you cannot have more than 2,000 grams of sodium, you need to, 2,000 milligrams of sodium, 2 grams of sodium. You need to make sure that you limit your intake of sodium to 2 grams of sodium a day and no more than that. So please watch your diet and make sure that you cut that out. There are different countries which have different diets, like even Chinese food has MSG. So that again, you need to make sure that you watch your sodium intake in that. Meditation, as I mentioned before, is extremely important. So please look into that and see what types of meditation you can do to help yourself. Now, what are the problems people have when they have high blood pressure? Again, high blood pressure can cause problems with congestive heart failure. A lot of times, the first manifestation of undiagnosed high blood pressure is congestive heart failure. People come in with shortness of breath, swelling in the ankles. That's high blood pressure, and the first thing you see is that, it is because they haven't treated it for a long time. Other complications include kidney problems. Gradual kidney damage from the high blood pressure can cause kidney failure. So those are some of the other complications with high blood pressure. Stroke, high blood pressure can cause a stroke. So that's another complication of another vital organ that has been affected by that. You can have a heart attack as well. So all these complications make you aware that having high blood pressure and not feeling it doesn't mean that it's not going to affect you. In the long run, it can be a very dangerous thing for you. Now, how do we screen patients for heart disease? We've talked about all the risk factors. We talked about some of the stuff we can do to prevent them. But we still want to know more with more calculated or objective data. So for heart disease, I generally suggest that patients above the age of 50 should consider getting a calcium scoring CT scan if they have at least 2 or more risk factors for heart disease. So a calcium scoring CT scan is usually about $70 that you have to pay out of pocket. It takes about 10 seconds, but it gives us information on how much plaque you have in the arteries around your heart. And depending upon the plaque amount, you can then judge your risk, whether you're low risk, moderate risk, or high risk for manifestations of coronary artery disease. Because once you have plaque, it means you have coronary artery disease. The severity of it obviously can be assessed with further testing if you have a positive calcium score with stress testing. So that is one of the important tests that has come with us. And, I've seen that people who haven't had any symptoms, we've done a calcium score, they've ended up having significant heart disease, and it saved them from a massive heart attack in future. So it's a very, very helpful test for us. Carotid screening. We do these screening studies where they just screen for any blockages in the carotid arteries. And that helps because if you know you have it, even if it's mild, you know that you have to follow this patient every so often so that it doesn't progress to be bad enough to cause a stroke. When carotid screening wasn't around, of course, we would miss patients who had a significant blockage and ended up having a stroke, which was entirely preventable. So that's another thing. Medicare says that at the age of 65, there should be a screening for an aneurysm of the abdominal aorta. So that can be done with an ultrasound. And again, that can be a silent killer if it is not detected. So abdominal aortic aneurysm screening is done at the age of 65 and paid by Medicare. So please look for that. And your primary care physicians will do that. So do sign up with a primary care physician for that. Another one is blood flow to the legs. A lot of times people have poor circulation in the legs. They only find out when they start having pretty bad symptoms like cramping in their calves or cramping in the back of their thighs when they walk. For that, we have a test called ABI, where we check the blood pressures in the legs and the arms and look at the difference. And we're able to see if there's a significant reduction in the circulation or the blood flow to the legs. So that would be an important test for screening for any blockages or circulation issues in the legs. Another test we do in our office is the electrocardiogram, and you may have seen that. They put these stickies on your chest, they print out this little pink sheet, and that will tell us about the electrical activity of your heart, whether it's slow, normal, fast. It will tell us if there is any evidence of reduced blood flow or a previous heart attack or any arrhythmias, which is abnormal heart rhythm, that can show up on the EKG. So it is extremely important. I recently had a patient who had her only symptoms were some swelling in her legs for a few months, and she came into the office. We did an EKG, and turns out, her heart was so slow, it wasn't pumping properly, and she ended up needing a pacemaker. So that is another screening tool we use to detect different problems with the heart. Stress test. That, as you all know, is a test that we do to see if there's reduced blood flow to the heart muscle. There's different types of stress tests. A simple test on the treadmill, that's something we do just to look at your EKGs and see how there's changes. We do the treadmill in combination with a nuclear test called a stress cardiolite scan, and that gives us twice as much information both on the EKG with exercise and then the blood flow to the heart muscle. It shows us how different parts of the heart muscle are getting blood flow, and if there's any reduction in any area, then we basically see that that needs to be checked out further by a heart catheterization or a coronary angiogram. So that would be one of the tests. Another one is a stress echocardiogram. So if you don't get the cardiolite done, which is the test which we inject a radionuclide in your system, is that we exercise you and then we do an ultrasound on the heart to see how strongly it squeezes or if any part of the heart gets weaker with exercise, meaning it's not getting enough blood or enough juice. So that's another type of a stress test we use. There's other forms out there too, like exercise bike and things like that, but these are the three main types of testings that we use for heart disease. Now, what can we do in our community and what are the simple steps that you can start today? Simple steps include checking out your risk profile, maybe going online and checking out ASCVD, Risk Estimator Plus, and plugging in your information to see what your risk is. And once you see that, then you can discuss it with your primary care physician or with your specialist and see what you need to do and what are the steps you need to follow. In some cases, yes, that's true. The common thing is common. The chest pain that you have always heard about is always a common symptom. But we do see women having different symptoms. Some of them include excessive fatigue. They'll state that, for the last few months, I've been extremely tired. I've had no energy. So that would be one of them. Another one is shortness of breath. Not having any chest pain, but simply, I could walk from my house to my mailbox without a problem. The last few weeks, I get extremely short of breath when I walk to my mailbox. That's another symptom. Another symptom would be back pain. So pain between the shoulder blades, that could be a symptom. Vague, diffuse, or chest pain all over the chest, not specifically on the left side, that could be a symptom. Some patients have simply said that they've had a headache. But more commonly, I would just say that the shortness of breath, the fact that they have pain between the shoulder blades, and the fact that they've had excessive fatigue, those are some of the symptoms that women come up with and not come up with the typical symptoms that have been described. Well, that's a very wide question because there are many over-the-counter supplements that can actually be detrimental to your health. So I would say let's be more specific. Of course, multivitamins are important to keep yourself healthy. So I would suggest multivitamins would be the over-the-counter supplement that I would recommend. The others, it would be difficult unless I know which one we're talking about in particular. Well, as you know that people who are older than the age of 65 and also anybody who has heart disease or any underlying risk, especially heart failure, are at a higher risk of having complications from COVID-19. And as you've heard, those with underlying health issues tend to have more problems with COVID-19 or more complications of COVID-19. So certainly, if you're above the age of 65, if you have a history of congestive heart failure, please be very, very careful. I've noticed that people are getting more lax and not really caring about it because it's as if they've become immune to the information. But others may be like that, but please take care of yourself. If you are above the age of 65, if you have a history of congestive heart failure or coronary artery disease, please make sure that you protect yourself, you wear a mask when you're in public, and try to stay away from people who have been exposed or have COVID-19. I have a lot of patients who will ask me about caffeine. They'll come to me with vague symptoms. They haven't been able to sleep properly. They're having a lot of palpitations. Palpitations is a big deal. We see a lot of people with palpitations. And, they not only do they get palpitations, they get extremely anxious with palpitations, and then they're not able to function. They become irritable. It affects their relationships with people. And it all boils down to when we ask them, so do you drink any caffeine? And the response would be, oh, I drink a 2-liter bottle or 2-liter bottles of Dr. Pepper every day. Somehow Dr. Pepper is the big deal these days. So drinking sodas with caffeine and coffee, it's very easy for people to say, not much, I just have a pot of coffee a day or 2 pots of coffee a day. Caffeine in these amounts, in large amounts, is extremely detrimental to your health. It affects your sleep. You can't get sleep hygiene. It causes tremendous amount of palpitations. It makes your heart really stressed out. So there's nothing wrong with drinking some caffeine, but like I said, everything in moderation. A cup or 2 of coffee a day is okay. Maybe a can of soda a day is okay. But when you drink 6 cans or when you drink, 6 cans and a pot of coffee, you're really trying to do something to yourself, which is rather detrimental to you. So please be careful with your caffeine intake, because people don't realize it, and it gets to the point where it causes a number of problems for them. So please be aware of that. Also, I've learned that excessive caffeine irritates your bladder. So if you're getting up at night multiple times and not getting enough sleep, it could be your excessive caffeine intake. So it's not just the heart, it's not just the stress level, it's not just the palpitations, it's other organs that can be affected by caffeine. So that is also critically important, the caffeine intake and the amount.
We hope you enjoyed the presentation today. For more information or to schedule an appointment with Dr. Zafar at UT Health East Texas Physicians in Athens, visit uthealtheasttexas.com or call 903-676-5880. Our next virtual seminar will be announced soon. Follow us on Facebook to stay up to date on upcoming events and seminars. Thank you for joining.